right, the other side of the coin on basal ganglia dysfunction, we talked about hypokinetic disorders. The other side is hyperkinetic disorders. So hyperkinetic disorders usually involve abnormal involuntary movements, and they are characteristics of Huntington's disease, which is a genetic disease, dystonia, Tourettes disorder, and some types of cerebral palsy. And of course, we talked about different types of cerebral palsy a little bit in Chapter 5, and it depends on, the effects depend on the area of the brain that is affected. So if the basal ganglia is affected, you could end up with some basal ganglia effects in cerebral palsy. So Huntington's disease, it's a genetic disease. It's an autosomal dominant hereditary disorder, causes degeneration in a lot of areas of the brain, most prominently in the striatum of the basal ganglia and the cerebral cortex. So the signs of the disease include chorea, which is that writhing sort of movement pattern, and it eventually develops into dementia. So there is a genetic test. If you know Huntington's disease runs in your family, you can be tested for it. And there's no cure for it. The only the advantage of testing is that you can plan for what you're going to do later on. And so I've worked with a few different people with Huntington's disease. It's not as common to see people with Huntington's in physical therapy, but I worked with someone who had pretty early onset, and they had some disordered movements, but doing pretty well. And mostly we were working on getting him into a good, solid exercise program so he could stay healthy as long as possible. And then I've worked with people in an inpatient setting with more advanced Huntington's disease that included the dementia. And one lady, she was very adamant that she didn't want to use a wheelchair and she wanted to walk, the main problem being that she couldn't. And so she was falling a lot, and she was, because of her dementia, she was quite difficult to control, and the main focus was on keeping her safe. So definitely a disease that you'll probably know if you have it in your family, and there is a test for it. So this shows the top one is a normal cerebrum, and the bottom one is a person with Huntington's disease. And so you can see how in the bottom picture there is more atrophy in several areas of the brain. And that's the effect of Huntington's disease, basically. There is a video in the module that shows someone with Huntington's disease, and there's one that someone made about their brother who has Huntington's disease. And so you can watch those if you like. Dystonia is usually genetic, is usually non-progressive. Dystonia is characterized by involuntary sustained muscle contractions that cause abnormal posture, twisting, and repetitive movements. So I worked with a woman a few years ago who had her diagnosis. They were trying to differentiate between dystonia and Parkinson's because she had the twisting and the abnormal posture, and she didn't really have any of the other markers for Parkinson's. They diagnosed her with dystonia. She had a lot of orthopedic issues that were probably also caused by her dystonia, but she chose to treat them in a different way. She had a lot of surgeries on her feet and ankles, and she was in physical therapy a lot because she was working on recovering from those. But a lot of times, if someone has dystonia, it can increase during activity and emotional stress, but it vanishes during sleep. And then some people say that Also, if they have a glass of wine or something like that, their tremor or their movement disorder will completely vanish. So a tremor is frequently associated with dystonia. So a lot of times when someone goes in with a tremor, they're trying to differentiate, is this caused by Parkinson's? Is this caused by something else? And the increasing during activity and stress and vanishing during sleep, that is one of the hallmarks that can differentiate it as being dystonia. So there's the pathology box in the book for focal hand dystonia. So focal hand dystonia is a basal ganglia dysfunction that tends to affect people that do some kind of highly repetitive movement pattern, like musicians or people that do certain types of arts or things where they're doing a highly repetitive movement pattern. And it's genetic, so they have a predisposition to it. It's chronic. Almost everything is normal, but you have that impaired sensory and motor issues. And the cerebrum and the basal ganglia are affected. The way I've heard it described, a lot of times that musician's dystonia, it's a focal hand dystonia, affects about 1% of professional musicians and usually terminates their career, which I think is really interesting in terms of the incidents. There's a video in the module with a guitarist who had focal dystonia, and he actually developed something from some one-handed playing techniques, which is pretty interesting. The average age of onset is 45 years old, and males and females are affected equally. So the way that I've heard it described is it's sort of like you lose part of your sensory information in your cerebral cortex. So your primary sensory cortex can no longer differentiate between different fingers, different areas of your body, and so it changes your movement. So we talked a little bit in Chapter 10 about the sensory input to movement. And so if that sensory input is blurred, you're not going to have good quality movement. So very interesting. Tourette's disorder causes vocal and motor tics. And they usually involve abrupt, repetitive, stereotyped movements. Meaning that it's a certain type of movement that you'll see over and over again with people with Tourette's. So a lot of times people with Tourette's, they're aware of, like they can almost feel like, oh, I can feel that a tic is going to come on. It can be exacerbated by stress, emotional excitement, and fatigue. Sometimes they can be temporarily and voluntarily suppressed, but that sensory urge builds up during suppression. Usually the onset is during childhood. We don't see a lot of Tourette's in physical therapy because there's not really a physical therapy treatment for Tourette's. Chorioathetotic cerebral palsy. So we talked about that athetosis in Chapter 5, which is that slow, writhing, purposeless movement, and the chorea are the abrupt, jerky movements. So those abnormal involuntary movements are, they're classified in those two different ways. So they're usually associated with lesions involving the basal ganglia and part of the thalamus. So with cerebral palsy, your effects are very much determined by what area of the brain is affected. So you could have a movement disorder as a result of cerebral palsy.